You are a fully qualified doctor. You have spent a minimum of 10 years training. You understand how the human body works at a cellular level. You can diagnose conditions that would have killed entire populations 2,000 years ago. You have access to the most advanced medical knowledge in the entire history of human civilization. Now you are in ancient Egypt, 3000 BC. Someone is dying in front of you, and the people standing around that body are about to hand you a toolkit that includes onion juice, crocodile dung, and a prayer to the god of medicine. The question is not whether your knowledge is better than theirs. It obviously is. The question is whether any of it actually saves you. Here is the first thing most people do not consider. Ancient Egypt had one of the most sophisticated medical systems in the entire ancient world. Egyptian physicians were not witch doctors. They were not guessing. They had written medical texts, the Ebers Papyrus and the Edwin Smith Papyrus, that documented hundreds of conditions, symptoms, diagnoses, and treatments with a level of systematic organization that would not be matched anywhere in the world for another 1,000 years. Egyptian physicians understood that the heart was connected to the body through vessels. They performed surgical procedures. They set broken bones. They treated infections with honey, which we now know has genuine antimicrobial properties. They used willow bark, which contains the same active compound as aspirin, to reduce fever and pain. Some of what they practiced was not just superstition. Some of it actually worked. A modern doctor arriving in ancient Egypt would not be walking into ignorance. They would be walking into a highly structured medical establishment with its own hierarchy, its own rules, its own sacred texts, and its own deeply held beliefs about why people get sick and how they get better. And that establishment would expect the new physician to operate entirely within its framework. The problem starts immediately. Ancient Egyptian medicine was inseparable from religion. Disease was not understood as a physical malfunction. It was understood as the result of supernatural forces, angry gods, evil spirits, or the violation of sacred rules. Treatment therefore required both physical intervention and religious ritual performed simultaneously. A physician who attempted to treat a patient with physical methods alone, without the accompanying prayers, incantations, and offerings to the relevant deity, was not practicing medicine in the Egyptian understanding of the word. They were doing something incomplete, disrespectful, and potentially dangerous to the patient's spiritual well-being. A modern doctor's entire training is built on the exact opposite philosophy. Eliminate the supernatural, find the physical cause, apply the evidence-based treatment. The two frameworks are not just different, they are structurally incompatible. And the people around that dying patient would know immediately that something was wrong with this physician who wanted to skip the prayers and go straight to the examination. But let us say the modern doctor is smart enough to adapt. They learn the rituals, they perform the incantations. They do everything expected of an Egyptian physician while quietly applying their actual medical knowledge where they can. This is not impossible. It just requires a level of cultural intelligence that goes far beyond medical training. Here is where the knowledge advantage starts to become genuinely complicated. A modern doctor knows what causes infection. They know that bacteria exist, that they enter wounds, that they multiply, and that without intervention they can kill a patient who would otherwise survive. They know this with absolute certainty. But in ancient Egypt, they cannot prove it to anyone. The concept of invisible organisms causing disease does not exist. It cannot be demonstrated without a microscope that will not be invented for 4,000 years. If a modern doctor tells an Egyptian patient not to let the wound touch the soil because invisible creatures in the dirt will get into the blood and cause fever and death, that patient will look at them as if they have lost their mind. The knowledge is real. The ability to communicate it in a way that anyone will believe or act upon is essentially zero. This creates a deeply frustrating paradox. The modern doctor knows exactly what is killing their patients: sepsis from infected wounds, waterborne parasites from the Nile, malaria from mosquito bites, tuberculosis spreading through close contact in confined spaces. They know the cause, they understand the mechanism, and they have absolutely no means of treating any of these things with the tools available to them. There are no antibiotics in ancient Egypt, no antifungals, no anti-parasitic medications. No surgical anesthesia beyond alcohol and herbal sedatives that are largely inadequate for any serious procedure. The drugs that define modern medicine simply do not exist and cannot be synthesized from available materials. What the modern doctor does have is their diagnostic ability. And in ancient Egypt, this alone would make them appear almost supernatural. Egyptian physicians diagnosed by observation and by consulting their texts. A modern doctor diagnoses by systematic elimination, by understanding which symptoms cluster together to indicate which underlying condition, by reading the body as a system rather than a collection of individual complaints. This is a fundamentally more powerful diagnostic approach, and it would produce results that Egyptian physicians could not consistently replicate. A modern doctor would correctly identify conditions that Egyptian physicians misdiagnosed routinely. They would predict the progression of diseases with an accuracy that seemed impossible. They would understand which patients were likely to recover and which were not, and explain why, with a precision that no Egyptian physician could match. In a culture that already believed medicine was partly divine, a physician who seemed to know things they should not be able to know would rapidly acquire a reputation that was either extremely valuable or extremely dangerous. Because there is another problem that the modern doctor has not yet solved. The social structure of ancient Egyptian medicine was rigid and hierarchical. Physicians trained within specific temples, under specific masters, following specific sacred traditions passed down across generations. A stranger appearing from nowhere, with no temple affiliation, no documented training, no master to vouch for them, and unconventional methods, would not be trusted, would not be given access to patients, would potentially be seen as a threat to the established order. Getting past this barrier required either exceptional political skill, an extremely fortunate early encounter with someone powerful enough to grant protection, or a sufficiently dramatic demonstration of medical ability at exactly the right moment. None of these are guaranteed, and without one of them, the modern doctor's knowledge stays entirely locked inside their own head, useful to nobody, including themselves. The survival question is not really about medicine at all. It is about whether a person trained to operate within one of the most rational, evidence-based systems ever developed by human beings can successfully navigate a world where that rationality is not just unrecognized, but actively incompatible with the social structures that determine whether you eat, sleep safely, and wake up the next morning. So, would a modern doctor survive ancient Egypt as a physician? Here is the honest verdict. The medical knowledge alone does not save them. Without drugs, without sterile equipment, without the ability to communicate germ theory to anyone who will believe it, the gap between what the modern doctor knows and what they can actually do narrows dramatically. They watch patients die from conditions they can diagnose perfectly and treat not at all. The social navigation is what actually determines survival. A modern doctor who is humble enough to work within the Egyptian system, intelligent enough to layer their actual knowledge quietly underneath the expected religious framework, and perceptive enough to identify the right moment to demonstrate their diagnostic ability to the right person, has a genuine chance of not just surviving, but thriving. They would become the most sought-after physician in Egypt, not because of their drugs or their equipment, because of the way they saw, because of the diagnostic instinct that 2,000 years of accumulated medical thinking had given them, because they could look at a patient and know things that no Egyptian physician had ever been trained to see. The knowledge does not save them. The way of thinking might. And that, it turns out, is the most durable medical tool a doctor has ever possessed. Subscribe for a new survival verdict every week, and if a modern doctor in ancient Egypt sounds challenging, wait until we look at what happens when a modern athlete walks into the most brutal physical training program the ancient world ever produced. I will see you in the next one.